What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. In this video today, I'm going to talk about the most important test of your medical career. If you're on the path to be a doctor, you want to be a pediatrician, a pathologist, radiologist, neurosurgeon, plastic surgeon, this test right here is the most important test of your career. Everyone talks about the MCAT, getting into medical school, that determines what medical school you get into, how much assistance you're able to be afforded in terms of financially. But the most important test of your medical career is going to be step one. I have other videos about how to prepare for step one and kind of how I approach step one, but step one, for those who don't know, is taken after your second year of medical school. So your first 2 years of medical school are in the classroom, where you're learning the basics of how to be a doctor, the basic science, the pathology, pathophysiology. And then the third and fourth year are in the hospital. This is when you do your rotations and you rotate through surgery, pediatrics, radiology, anesthesia. This is when you get your hands-on experience. But before you can even go to the hospital, you have to pass your step one for most programs. There are some programs that allow you to take your step one after your third year of medical school, which I think maybe actually be better. I think Baylor does that because the students, they have a higher step one average there because you see more clinical before you take your test, and I think you remember it better. But for the majority of schools, you take it after your second year of medical school. It's an 8-hour test. It covers everything from your first 2 years of med school and is the most important test of your medical career. It will determine which specialty you can go into. Say for instance, you make all A's during your first and second year of medical school, and then you get to your step one and then you score a 200 on your step one. It's going to be extremely hard, almost impossible, to get into a competitive specialty like neurosurgery or plastic surgery or dermatology. That's the reason why I said this is the most important test, because if you wanted to become a dermatologist and you score a 200 on your step one, you're most likely not going to become a dermatologist. So this determines what type of doctor you will be. You would just have to resort to going into a less competitive specialty. So make sure that you understand that you need to focus on your step one preparation in your first and second year of med school. I have another video about how grades, they don't really matter that much in your first and second year, but your step one is most important. So make sure you really focus on that. And going into med school, if you haven't started yet or started your first year or second year, you need to have a plan. It needs to be specific, it needs to be concrete, and you need to stick to your plan, because you get one chance at this. There's no retaking step one unless you fail. So if you don't get a score that you want, that's pretty much it. Some people try to take step two and try to increase their score on step two, but there's nothing that's going to replace a substandard score on step one. So just study really hard, do well on it, and that will open up a lot of doors for you. That way you can go into any specialty that you want to. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.